Hi, we are back today at Pelican Drug in Pelican Rapids. I'm here today with Jenny Field, a pharmacist here, and we're going to talk about cholesterol. It's not exactly everyone's favorite topic, but Jenny has some great information to share with us. Jenny, what is cholesterol?
Well, cholesterol is a waxy substance in your blood, and it helps you absorb and digest fat. And cholesterol is important for building healthy cells in the body, but too much of it can be a problem. It can cause plaques in the vessels and clog it up, and which can eventually lead to heart attacks and strokes and other heart problems.
Okay, how do I know if I have high cholesterol?
Well, the only way to really find out is with a blood test. So you can go to your doctor. It's just a simple blood test. They take a little bit of blood and they run it, and you get a couple values back. There's 4 key values that you get. There's your overall total cholesterol, and then it breaks down and you get an HDL cholesterol, which is what they call your good cholesterol.
Okay.
And then you get your LDL cholesterol, which is your bad cholesterol, and then you also get a triglyceride level.
Okay. So what are normal or healthy levels of cholesterol?
Typically, your normal levels, they shoot for your total cholesterol under 200. Your HDL cholesterol is your good cholesterol, if you remember, and that one they want above 40 for men or above 50 for women. And then your LDL cholesterol, they shoot for under 100, and your triglycerides, they want less than 150.
Okay. So what can I do if I have cholesterol and I want to prevent having high cholesterol?
Well, your cholesterol is made up of kind of 2 different components. There's your genetic component, which you really can't change at all. It's your family history. If your parents had high cholesterol, you're more likely to get it. But there's your lifestyle changes that you can do, and that's what you can really change. So eating a healthy diet full of fruits and vegetables, keeping your fats low, exercising regularly, maintaining a healthy weight, and then not smoking.
Okay. What foods should I avoid if I have high cholesterol?
Foods to avoid are typically foods with trans fat, that are high in trans fat or high in saturated fat.
Okay.
So saturated fat comes from animal products. So red meat, eggs, full fat dairy products. You don't want to cut them out completely, because they're good for you too, but you don't want to eat red meat and whole milk for every meal.
Okay, I got it.
And then trans fats are from packaged foods.
Okay.
So eating a lot of chips and cookies and all of the fun stuff we like to eat, limiting those is always good too.
Okay. So if I need to take some medications to treat my cholesterol, what kind of medications would I be looking at?
Typically, there's one big class that they look at, and it's called the statins.
Okay.
Lipitor or atorvastatin, Crestor, rosuvastatin, and simvastatin or Zocor. Those are a couple that they use. Typically, those are the ones they start with. There are other classes of medications, but they're usually reserved for add-on therapy if you just need a little more boost.
Okay. So let's say I have high cholesterol. My doctor says I need some medication, but I am stubborn and I don't want to take it. What's going to happen?
Well, you might not notice anything. You probably feel fine, but the plaques are going to be building in your arteries, and their vessels are going to be narrowing, and that can lead to chest pain and eventually lead to a heart attack or a stroke, and then it could lead to death. And
Okay.
so it's a very important issue to get under control.
Absolutely. If I'm on medication, how long am I going to be on medication?
If you're going to be on medication, it's typically going to be lifelong. Cholesterol doesn't go away once you get it under control. You stop taking the medication, it's just going to go right back up to where it was. There are a few exceptions if you lose an extreme amount of weight and you make extreme lifestyle changes, but that's typically not the case. So typically it's going to be a lifelong therapy.
Okay. Well, this was a lot of great information. Maybe not everyone's favorite topic, like I said, but it's important information, and I thank you very much for sharing it with us.